Knee arthritis, like most orthopedic conditions, improves gradually over time with physical therapy. In physical therapy, our goal is not necessarily to get rid of the arthritis itself. We cannot reverse the arthritis, but what we can do is improve the way the knee functions and reduce the symptoms coming from the joint. One of the biggest ways we do this is by building strength in the muscles that support the knee, especially the quadriceps, hamstrings, and hip muscles. The stronger these muscles become, the more force they are able to absorb when we walk, stand, climb stairs, or perform daily activities. When your muscles absorb more force, less stress gets placed directly into the arthritic knee joint. And when less force goes into the joint, symptoms like pain, irritation, and stiffness tend to decrease. We also work on improving mobility and range of motion in the knee. Movement helps lubricate the joint and allows the knee to move comfortably through a greater range of motion before symptoms begin. And this is really the overall goal of physical therapy for arthritis. The arthritis may still be present on imaging, but you are no longer significantly limited by symptoms. It's also important to understand that this process takes consistency and patience. Most people start noticing changes in pain levels within about 2 to 4 weeks of consistent physical therapy. More meaningful long-term strength changes usually begin around 4 to 6 weeks. It is important to note, however, that healing is dictated by a combination of factors, including injury severity, genetics, if you are allowing it to heal by avoiding aggravating activities, and if you are being consistent with your PT. All of these factors affect how quickly someone improves, which is why two people with seemingly similar conditions may recover at different rates. As a clinician, I personally try not to focus too heavily on exact healing timelines because not everyone follows the standard timeline, and that is completely normal. Sometimes rigid timelines can make patients feel like something is wrong if they are not better by a certain point, when in reality, some people simply take longer to heal. So if progress feels gradual at first, that is completely normal. Next, we'll discuss what not to do with knee arthritis, because this is often where many people unintentionally get stuck and stop making progress.